So a breast lift or mastopexy is basically exactly what it says. It's lifting the breast up higher on the chest wall, positioning the nipple in the center of the breast, and sort of reshaping the breast back to a full, youthful breast. I tell people, anybody really with a B cup or larger breast, if they have their own tissue and it's just not where it used to be anymore, we can create them a beautiful breast with just a lift. So a good candidate for a breast lift is going to be anybody that has, a lot of my patients have lost weight, and so they have excess skin that's sort of, sagging around where the volume used to be. People that have had children, so their skin on the breast has been stretched from growing several sizes with pregnancy, going back down, plus or minus enlarging and going back down with nursing. Basically, it's just people that have had volume increase and then, shrinkage of the gland, and we are going to reposition that gland back up where it used to be. If you have really, a full B and above cup as far as breast tissue, we can make you a beautiful breast with your own tissue and just tailoring the skin around it. Recovery time for breast lift, I tell my patients to take a week off of work to be safe. I usually do leave a drain for a couple of days, usually doesn't stay any longer than 3, maybe 4 days. And people are good to go back to work after 1 week. We do kind of restrict lifting for maybe 3 to 4 weeks after this procedure, but certainly if you have, an inside desk job where you're not having to lift or do that much physical activity, 1 week is plenty of enough time. Also on recovery, breast lift it's shockingly not that painful. It's usually like burning incisional pain, but in the way of deep-seated pain is not bad at all. People are usually shocked with how little or sometimes even no pain medicine they need after surgery.